Welcome to today's WHO Africa Media press briefing, which is taking place in collaboration with the APO group. First, some housekeeping. We have translation in 2 languages. So you can go to the globe on the bottom right-hand side of your screen, select your preferred language. Joining us from Johannesburg in South Africa is Dr. Mashidisho Moeti, the WHO Regional Director for Africa. Dr. Moeti will introduce the other panel. Welcome, Dr. Moeti.
Greetings to everyone participating in our meeting. That's too fast. Today we're going to be talking about, sorry, can we just start again, please? Just give us a few minutes.
Sorry about that.
Okay, this is.
Sorry, we are having some technical issues on Dr. Moeti's side. She'll be back in a second. Thank you for your patience.
Please check Dr. Moeti's microphone is muted.
Greetings to everyone participating in today's press conference on the rollout of COVID-19 vaccines to priority groups, specifically healthcare workers, older people, and adults with pre-conditions such as diabetes, hypertension, and chronic respiratory conditions. I'm very pleased, no, it's lower down. I'm sorry, we are continuing to have a technical problem here. Please excuse us. Right. You're too fast. I'm pleased to be joined for this conversation today by Mrs. Perpetual Ofori-Ampofo, the president of the Ghana Registered Nurses and Midwives Association, and by Mr. Ferdinand Sonyui, who is the chair of the Secretariat and Central Africa Regional Representative of Africa Non-Communicable Diseases Network. First, today marks 1 year since the WHO Director General, Dr. Tedros, described the spread of the COVID-19 as a global pandemic. However, the highest alarm WHO can ring under international law was already sounded much earlier. The Director General declared coronavirus a public health emergency of international concern on the 30th of January 2020. That declaration was a signal for all countries to urgently scale up response measures. In the coming days, Africa is expected to report more than 4 million COVID-19 cases and about 106,000 lives sadly lost. The continent has experienced a plateau over the past 3 weeks at around 70,000 new cases, and there is an upward trend in some countries such as Cameroon and Algeria. Sub-Saharan Africa and Algeria has now passed the milestone of more than 100,000 healthcare workers infected with COVID-19. That means 11 healthcare workers contracting COVID-19 every hour in this pandemic, accounting for 3.5% of all confirmed cases in the region. This proportion is higher in some countries such as Guinea-Bissau, Liberia, and Algeria, where over 10% of all confirmed cases among health workers. Slow it down. When health workers fall ill, our communities are affected from many causes. So we must do more to protect them, including on implementing the preventive measures to limit the spread of COVID-19. With COVID-19 vaccines now reaching the continent in limited numbers, healthcare workers must be at the front of the queue. We urge countries to follow WHO's guidance and vaccinate health workers first, as well as ensuring continuous access to personal protective equipment and providing funding for healthcare workers' investment plans to provide decent salaries, good working conditions, and sufficient staffing to cover the workload. This will help to reduce infections among frontline workers and relieve pressures on health systems. Older people and adults with comorbidities are also being prioritized for vaccination because they have a higher risk of severe illness and death when infected with COVID-19. Available data indicates, for example, that more than a third of COVID-19 deaths in African countries have been among people aged 65 years and above, whereas they constitute a much lower percentage of cases. This reminds us that access to treatment and action to prevent these mainly chronic non-communicable diseases needs much more investment and action in most countries in the African region. And we can't make strict separations between infectious and chronic diseases and really just need to speed up progress towards universal health coverage. WHO's guidance is to prioritize the most affected population subgroups in line with the local epidemiology, and countries have defined and included these groups in their national deployment and vaccination plans. The COVAX shipments continue at a rapid pace, and as of yesterday, almost 14.8 million doses have been delivered to 22 African countries. This is great news. 19 African countries have now started vaccination campaigns, and through COVAX, more than 518,000 doses have been administered. We're also supporting countries to monitor the circulation of COVID-19 variants, with recent confirmation of the B1351, which was first identified in South Africa, in Cameroon, Malawi, Namibia, Eswatini, and the Democratic Republic of the Congo. This variant has now been reported in about 15 countries, while the variant first identified in the UK has been reported in 9 African countries. In closing, I'd like to give a shout out to healthcare workers for your leadership, for your dedication, and for your sacrifice for the sake of the health of everybody in your countries. I'd like to thank you all for having joined us and look forward to a very good conversation today.
Thank you, Dr. Moeti. Now let's turn to Mrs. Perpetua. Please tell us more about health worker infection.
Thank you very much. I bring you greetings from Ghana, and specifically the Ghana Registered Nurses and Midwives Association. Yes, COVID has not spared us as health workers. In Ghana, already as at 4th March 2021, we've had about 4,585 health workers who are infected. And as at October 2020 last year, we had about 14 deaths. And this is information from the Ghana Health Service. We ourselves as a union also collated our own data. And as of July 2020, we had about 840 of our comrades being infected. As at then, we had 3 deaths, and the rest of them fully recovered. As at January this year, we had 789 of our comrades who were infected, and the death toll has risen to 6. This is no different from the stories that we hear from our sister African sister unions and other African countries, and globally, health workers have not been spared. When we look at the figures, we know that over 100,000 have been infected, over 17,000 have died. This, of course, means that although we are health professionals, we know more about diseases and its impact and so on, we are not immune to the COVID-19 virus. And that is the more reason why we have called on all stakeholders, especially our our national governments and so on to prioritize the vaccination of health professionals. What I can share with you is that in Ghana, the vaccination rollout was initiated on the 2nd of March. And we had our President, His Excellency Nana Addo Dankwa Akufo-Addo, leading the way by getting vaccinated first, together with his spouse and the Vice President and his spouse. The program of the expanded program on immunization of the Ghana Health Service was to ensure that there are various phases of this immunization program that was planned from March to October. And the March to October simply means that not enough vaccines are available at a time to vaccinate everybody. The first batch of vaccines that were received was through the Covet system. And at the moment, out of the over 140,000 health professionals or health workers in Ghana, we know per the figures from the Ghana Health Service that 60,398 have been vaccinated. The first phase of the vaccination covered 3 regions out of the 16 regions in Ghana, and that was the Greater Accra, Ashanti region, and the Central region. And that together meant that we were looking at a figure of 66,686 health workers. And out of this number, we know that 30,974 are nurses and midwives. So if we know that as at yesterday, 10th March, already 60,398 health workers have been vaccinated, then we want to believe that majority of our nurses and midwives have also received the vaccine. One thing to note is that this vaccination is not restricted only to the public sector. It also covers the private sector. So much focus is also on the community pharmacists, who are almost the first point of call for most Ghanaians. And in fact, not only in Ghana, but in most African countries. When somebody is having a headache or is coughing, the first point of call is a chemical shop or a pharmacy shop. They will not get up to go to the hospital. It is when they notice that their condition is getting worse, that is when they will move to the hospital and seek care. So for the vaccine program, the next phase, which is going to start on the 15th of March, is going to see to the immunization of health workers across the other 13 regions. And we are looking at a number of 76,078. And if you add a proportion of the private, then this will go up a little more. And we are hoping that everybody will get vaccinated. We've had to deal with issues of hesitancy on the part of some of our health workers and on the part of Ghanaians as a whole. And these had to do with the various conspiracy theories and myths running out there, that there are chips in these vaccines, it can affect your fertility, your potency as a man. It has been what is being used in other Western jurisdictions. It's not the same vaccines that are going to be given to Africans, and therefore it's going to have a negative impact on us. We have tried very hard to educate and sensitize the general public, and specifically for us as nurses and midwives. The union has taken it up, and we've had virtual engagements with members using a virtual seminar. And we have also developed flyers that we have sent out. And these are targeted to educate nurses and midwives to let them understand that, of course, vaccination has been with us for so many years. And indeed, if the white man wanted to kill us all, we would have all not grown to this age, we would have died earlier. And that the vaccines are safe, and therefore there's no need for us to harbor any fears. The leadership of the nursing and midwifery fraternity in Ghana, through the assistance of the Nursing and Midwifery Council, the registrar, we collaborated with one of our districts, and they launched their vaccination rollouts, and we were the first to get vaccinated. That is the nursing leadership. So myself and other comrades, including the registrar of the council, our chief at the Ministry of Health, and at the Ghana Health Service, we all got vaccinated. We took pictures, we shared on social media, and it was live on Facebook. And the hope was to assure our members that the vaccines are safe and therefore they should all get vaccinated. And I'm sure it has contributed to the large number of our comrades who have stepped up to get vaccinated, and we are happy about that. Going forward, it's important that our various countries understand that we cannot sit back anymore when it comes to vaccine development and all that, and even some medications and logistics that we need in the health sector. It's about time we develop the infrastructure and the personnel to handle some of these things, so that there's so much money that is pumped into importation of vaccines year in and year out. Those monies can be pumped into local research and vaccine development and medicine development, so that we can have what we need at any point in time. That, of course, will also develop the trust of the people, and they can know that once it is from their own people, they can be safe in the use of it. We have realized that the Covet system is making provisions, but that is not enough. We have also joined hands with the People's Vaccine Alliance to call on governments around the world to add their voice to the World Trade Organization to waive the patency rights on these vaccines, so that the technology can be made available to countries that have reputable pharmaceutical companies in order to develop these vaccines, so that everybody can have vaccines and get vaccinated. Because if we have to go the way we are going now, what it means is that there are certain countries that are going to have to wait for a year or a year and a half before some vaccines will even get to them. So we call on for more investment in health workers, especially nurses and midwives, if we really want to achieve universal health coverage by the year 2030. And we need to, in order to prepare ourselves for any such future pandemics. Thank you very much, and God bless you all.
Thank you, Mrs. Perpetua. Indeed, the vaccines are safe and effective. So let's turn to Mr. Ferdinand. Can you please tell us why we should prioritize people with chronic diseases for COVID-19 vaccination? Over to you, Mr. Ferdinand.
Thank you very much. I wish to, first of all, thank God for the opportunity to bring these remarks. And secondly, to thank you all for making yourselves available to listen. I wish to thank the WHO regional team for the chance to actually bring a perspective on non-communicable disease comorbidities, COVID-19 and the vaccines. I'll be doing so both from as a young person, as a young advocate for health, and also as a civil society leader on NCDs in Africa. So we already know that 82% of the 16 million people who die prematurely from non-communicable diseases, of course, mainly heart disease, stroke, cancers, diabetes, and chronic lung disease. These occur in low and middle income countries, including Africa. Of course, and Africa is projected to experience 27% increase. That is 28 million more deaths annually by 2030. So the problem with chronic NCDs is not just that people are dying, but that they are dying too young from avoidable risks. We also know that the World Health Organization the strategic 5x5 matrix highlights the main categories of risk factors of NCDs and risk factors. And not surprisingly, they are the leading chronic pre-existing conditions responsible for millions of deaths we see today as a result of co-infection with COVID-19 virus. This includes, but not limited to, diabetes, hypertension, and you have other risk factors for these two, like obesity. Obesity, for example, is a significant risk factor for other NCDs and tops the list in risk for COVID-19 severity due to comorbidity. COVID-19 in people with comorbidities has increased the severity of the viral infection, leading to higher deaths than in a general population. We know that some of the measures that have been used, like partial lockdowns or restrictions, have limited access to prevention and treatment or control for people living with diabetes, with cardiovascular conditions, obesity, asthma, and other NCDs. So people living with NCDs need attention because they have needs, they have challenges, they have priorities that must be listened to as we take meaningful action to combat COVID-19 in Africa. The Africa NCDs Network conducted an assessment late last year, which revealed that protection against the disease and knowledge of associated risks were the greatest needs expressed by African people living with NCDs during this time of the pandemic. And so looking at the African countries, some African countries like Cameroon, Ghana, South Africa, healthcare workers have come first in most of the plans that we have seen to roll out vaccines. We need to consider for whom the healthcare workers are caring. Yes, we know that they care for everyone, but people with chronic comorbidities die more in their hands than everyone else. It is vital to be specific on which NCDs and risk factors it is essential to focus on. And I think obesity, hypertension, diabetes are some key ones. Therefore, it is better, and we have encouraged people living with NCDs to follow prevention measures than risk getting the disease. And where vaccines are available, priority should be given to these people as the countries phase out their plans. We need to see that there is equity, especially looking at these groups of people who are vulnerable, like people with comorbidities. Thank you.
Thank you, Mr. Ferdinand. Now, on another note, we have our new Regional Emergency Director for Emergencies, Dr. Guy Salam. Dr. Salam will be telling us more about Ebola virus disease outbreak and other outbreaks in the region. And on hand, we have Dr. Nsenga Ngoi and Dr. Richard Mihigo. They will be there to answer your questions as well. Over to you, Dr. Salam, and welcome.
Thank you very much, Dr. Mary Stephen, and for having me. I just going to highlight about three major emergencies that are currently going on in Africa. The first is about the Ebola outbreak in Guinea. The second, the Ebola outbreak in DR Congo. And the last is about the emergency that were made with the blast in Bata in Equatorial Guinea. In the Ebola outbreak in Guinea, so far we have 18 cases. And among those cases, there is 4 probable cases, which means that they died before we were able to test them. And there is also 1 positive case that were tested positive and died later. So the lethality is about 50%. I just left Guinea about a couple of days ago, and our teams are on the field working in collaboration and completely embedded within the government team. And they are doing several work, including the detection. And once the cases are detected, they work with the team in Guinea, the government team, to do the investigation in order to identify the contact and follow them for the 21 days necessary. And also the contact of contact but because the contact and contact of contact should be vaccinated. So far, there is over 2,000 people that are 2,600 people that are vaccinated, and we have been for 7 days without a new case, but we should be very careful because the detection is not yet optimal. Because of we have to put it in place all the alert, and also for the death, whatever the cause of death, we should have an investigation and make sure that it is not related to Ebola. For the second outbreak, which is happening in North Kivu in DR Congo, we are in 12 cases. Yesterday only, we confirmed a case, but it is not a new case. It was a community death, and after investigation, it was classified as a probable case of Ebola. There also, our team are in place. They were there for the last outbreak that happened in the same places in Butembo and surrounding areas. And we have vaccinated so far about the half of the number we did in Guinea. 1,300 people are vaccinated there. And our team are working in close collaboration with the team that are in place. As you may know, DR Congo have a lot of experience dealing with Ebola, and even at the decentralized level, people have some competencies that were developed through those experience. They responded firstly with WHO. So our intervention is less important there, but we are still working in very close collaboration, and it is the decentralized level that are actually intervening for the Ebola outbreak in DR Congo. And the last one is related to the blast that happened in Bata in Equatorial Guinea, where we have over 700 casualties, including 105 deaths. And currently there is 478 people that are hospitalized in the different hospitals. The country actually needs help. They have asked to the international community for help, and we are identifying the specific need that the country has. And one of the most specific needs that they need is human resources, and human resources that are surgeons, that are emergency people, and also nurses who are capable of taking care of those that are directly affected by the blast. But also, you know that the health system in Africa, wherever we have this surge of cases in hospital, even the other diseases are not taken care well. So it is a comprehensive help in terms of health that they are needing. WHO currently has all our people that are in place and available sent to Bata. There are 5, but also there is collaboration for the emergency medical team. And one emergency medical team is flying to be sent to Bata from Europe. There is also some experts that are being fly from Congo to be sent to Bata. We should remember that a similar thing happened in 2012 in Congo, and they have experience dealing with it. So thank you very much for inviting me, and I'm available for question. Over to you.
Thank you very much, Dr. Salam. Welcome once again to the regional office. So we have heard from all our panelists. It is now time for you journalists to ask your question. To do that, please go to the question and answer function on the Zoom platform and send us your question, and let us know if you would like to go live with your question as well. We need to know your name and the name of the media organization you represent. So the first question now is from CGTN Daniel. This is going to you, Dr. Richard. Can you briefly explain to us Africa's vaccine storage capacity and preparedness as vaccines arrive, and some of the challenges and mitigation measures? Over to you, Dr. Mihigo.
Thank you very much, Dr. Stephen, and thanks for the question. So with regards to the African vaccine storage capacity, it's important to mention here that during the last couple of months, preparing for the arrival of the vaccine, WHO, working with the partners, have really supported country to map out the capacity, the existing capacity of cold chain in all the countries. This capacity has been factoring in the national deployment and vaccination plans that different countries have developed in order to be ready to receive the vaccine. So overall, what we can say is that based on the national deployment and vaccination plan, the majority of the country have the capacity to accommodate the vaccine, particularly that the vaccine are coming in several tranches, not overwhelming the existing capacity. We have also 12 countries that requested an additional support through the Gavi mechanism to increase their capacity in terms of cold chain. So from all the countries, and we have heard from the regional director, 22 countries that have already received the COVAX vaccines, we have not heard, we have not seen any issue with the vaccine storage. And we hope that this approach of having vaccine being delivered in several tranches is going to put less pressure on the system. Now, in terms of challenges, I think so far the countries that have started the vaccination, things are going on quite very smoothly. Indeed, there are some issues with notification of the data, the proper description of who should come first in terms of the priority groups. But in overall, I think the preliminary lesson that we are getting from country is that these vaccinations are going accordingly to the plans.
Thank you, Dr. Mihigo. So our next question is going to Dr. Moeti. Your question is from Maya of UN Brief from Switzerland. She's asking a similar question on vaccine preparedness and rollout of vaccination in Africa. And then the second question, I will pass it to Mrs. Perpetua. She wants to know how the Gavi vaccine arrival is seen by healthcare professionals and how the rollout of the vaccine is going on. Over to you first, Dr. Moeti, then Mrs. Perpetua.
Thank you very much, Mary. I didn't quite get the question. I understood it's going to be a question on vaccines.
Yes, so Mrs. Perpetua from Geneva is asking a question on the state of preparedness of vaccine rollout in Africa.
Yes, African countries have been working for some months now, and WHO established a partnership group at the regional level to support the development of their national plans for delivering the vaccines, and also after they'd been drafted, to review these plans and to advise on how to improve them so that they are fit for purpose in terms of the process of delivering vaccines. So there's been a lot of work using global guidance developed by WHO to make sure that the key aspects of delivering these vaccines have been taken into account. The context of vaccine delivery based on the extensive experience in the region on carrying out vaccination campaigns, mainly for children, have been taken into account. So I'll ask Richard to provide the details in terms of how we assess now the state of readiness based on some criteria of most countries in the region. I would say that the countries in the region have done a very thorough job of their planning. There has been a lot of investment in reviewing the vaccination campaigns in terms of the campaign plans, in terms of what we know of what works and the challenges that are faced admittedly by the current situation. So Richard, if you can just provide the detail in terms of the assessment based on the tool that we developed in WHO.
Yeah, thank you, Dr. Moeti. Indeed, just to confirm what you've mentioned, I think we went through a very, very elaborated but thorough process, as explained, whereby a tool, a vaccine introduction readiness assessment tool, was developed by WHO, and the partners disseminated to all the countries. This is like 3 to 4 months ago, to try to anticipate some of the needs. So while country were waiting for the vaccine to arrive, I think they did use that opportunity time to get very well prepared. And the tool was assessing 10 different components of the immunization system, from cold chain, as we have heard, communication, advocacy, monitoring of adverse events, the regulatory processes, and all of these different components were thoroughly assessed by the country, assessed on a regular basis, up to when they reach the stage of developing their national deployment vaccination plan. So I think to some extent, the long delay in vaccine arrival in Africa has been a positive thing to some extent, because countries really take that opportunity to get well prepared. And what we are seeing today, and we heard from the colleague in Ghana, when the vaccine landed in the country, less than a few days after, the vaccination started, and there is a very well elaborated process. The provinces have been identified based on epidemiology. The high-risk group have been enumerated and identified. So clearly hitting the ground running exercise. And we are monitoring closely this process, and the gaps that are being identified here and there are being addressed. So quite happy to see what is going on, but also on alert to make sure that any specific issue is addressed on a timely manner.
Okay, thank you very much, Dr. Richard. Mrs. Perpetua, can you comment on the second part of the question? How do you see, as health professionals, the arrival of the vaccine and the rollout of the vaccine?
Thank you very much. In terms of the arrival of the vaccines, we are all very happy. We were all very happy with its arrival, because for us as health professionals, we knew that if we have to nip COVID-19 in the bud, finally, what we need to do is get vaccinated. And it's not just about a few people getting vaccinated, but majority of the population being vaccinated. For on another wing, the fact that the Covet system brought these drugs free to us, we also appreciated governments for the processes they put in as early as last year to get these vaccines. But there were still some skeptics who thought that, yes, these vaccines are free, but we also need to enhance the processes of procurement to get more vaccines to ensure that we reach the target of 20 million of the population. In terms of the vaccine rollout, how it's going on, yes, the FDA played its role, the Food and Drugs Authority played its role in ensuring the safety of the vaccines way before they arrived. And the cold chain system was boosted. Training went on for nurses who were going to participate in the vaccination, and volunteers who were also going to be taking part in the whole process. So after the training, as I said earlier, on the 2nd of March, the rollouts began, and that is the deployment. But what we also identified was that the date, in terms of the data capturing, the application that needed to be opened and information of the individual entered, there were some challenges. And it was due to internet availability and all those things. But gradually, the Ghana Health Service and the EPI department or units have been able to rectify some of these things. And the vaccination is going on smoothly. Thank you.
Thank you, Mrs. Perpetua. So the next question is from Laila from BBC. She would like to go live. Laila, are you there?
I am here. Thank you very much. My question is for Dr. Moeti. How concerned are you, Dr. Moeti, about claims that Tanzania's President Magufuli has contracted coronavirus and is seriously unwell? And if he is indeed suffering from COVID-19, what does that say about the strategy towards the disease that the government has been pursuing?
Yes, thank you very much. Well, as WHO, we have no information directly from the government regarding the health of President Magufuli. We have, like everybody else, seen information that's circulating in the press, in the social media. And first, I'd really like to say I wouldn't like to speculate in any way until we have some verifiable information as to what is going on. We note, of course, that Tanzania has recently recognized that COVID-19 is a health issue for the country. This followed the passing away of the vice president of Zanzibar and a senior official in the government as well, and has called for the people to adopt important prevention measures such as the wearing of masks. So we see that as a positive step for the welfare of the population of Tanzania and the neighboring countries. What I can say as WHO is that we can only encourage the government to support the population, to urge the population to use these measures, to take every possible action that they can to support people to catch up, in a sense, in terms of their own understanding and their actions and the facilities and the equipments and the supplies available so that they can mount at the community level, individual level, and also at the public health level, the type of response that is needed. It's important that this includes the use of data to track the transmission of the virus in Tanzania. And we would very much welcome to start receiving from Tanzania data of the situation in the country so that we can provide support within the country and most importantly, of course, internationally to the neighboring countries in Tanzania. Then finally, we would also like to strongly encourage the country to join the vaccination efforts of the whole world, including through the Covet platform, so that they, like other governments, can protect their population from the spread of the virus. I think whatever is the case with President Magufuli, we can only wish him well if these stories are indeed true, and would very much reiterate our preparedness to support the government and the people of Tanzania.
Thank you, Dr. Moeti. The next question is from Naftali from Nairobi, Kenya. The first question goes to you, and Dr. Ngoi, you could complement, please. How serious is the threat of the third wave in Africa, and are there countries already experiencing it? And we have a complementary question. Do you see the continent managing to flatten the curve now that the immunization has commenced, and if so, when? Dr. Moeti, over to you, and Dr. Ngoi, you can complement.
Hello?
Hello, we can hear you. Over to you, Dr. Moeti.
Could you please repeat the question, Mary?
Yes, so Naftali is asking, how serious is the threat of the third wave in Africa? And are there countries that are already experiencing it? Then he's also asking, how is the continent currently managing to flatten the curve, given that the immunization has started?
Yes, I mean, I think that until such time as we have significant coverage with a vaccine and that we see a return of the implementation of the prevention measures, which we have noted in the past few months have progressively been reduced, especially at the population level, there is always a risk that we can get an upsurge of cases. We have seen that when there are events that cause gatherings of people, for example, so of course the latest was the festive season where people gathered in many of the countries, and we did see an increase in cases. And we know that there are going to be in a number of African countries elections taking place, which are always a cause for concern, because the risk then of campaign events and people gathering is increasing the risk of an uptick in cases. We are seeing currently an increase in new cases in some countries like Benin, Togo, Botswana, Cote d'Ivoire, Ethiopia, Cameroon. So I think the risk is always there, and we always have to be emphasizing the importance of sustaining at the individual level the protective measures, the use of masks, the hand washing, and the keeping of a distance, which we have observed really is suffering from population fatigue and needs a resurgence of the efforts, improvement of communication, better understanding, and sustained intensification of the public health measures. So we think that this is extremely important at the same time as the vaccine is being deployed. Vaccines are being deployed in countries and are protecting at least the worst outcomes, which are serious illness and deaths, while the continent strives to acquire the level of vaccine supplies that will help us to reach population immunity.
Thank you very much, Mary, and thank you again for the questions. I will just compliment as you requested on what Dr. Moeti said. Yes, first of all, we have a very technical definition of our third wave, depending on the percentage from the last peak of the last wave. So taking into account that technical definition, we're not yet there. But as Dr. Moeti said, we clearly have countries that have now an upward trend, like country like Cameroon. I mean, Dr. Moeti has mentioned some. That said, the risk, yes, the risk is again very, very real. First, let me clarify that the level of vaccination or the number of people who will be vaccinated, at least if this first round, is not significantly impact in terms of the transmission. We are going to protect people mortality. We are going to protect people from getting severe disease, yes. But in terms of significantly impacting the transmission, we need to still adhere to social measure as we have been trying to do it since the beginning of this pandemic. So the risk is there, and that's why, again, we need to emphasize with our communities to continue adhering to social measures. Thank you, Mary.
Okay, we've lost the sound.
Sorry, everyone. We're just having trouble with our
sorry.
moderator.
Yes, we're having problems with our moderator. I'm sorry about that. But since I know we're getting short on time, we can ask the following question, which is, sorry, just let me try and see what it is. The following question we have is actually on vaccines. So this, I guess, we have a question from Ben Television, Susan at Ben Television. And the question is, we'd like to know why there is no African country out of the 54 with an ability to produce any recognized vaccine for COVID-19. Does this not show that Africa is still relying on other countries for its development? And what can African scientists and the health industry do to bridge the gap? So perhaps, I don't know if Dr. Moeti or Dr. Richard Mihigo if you would like to answer these questions. Thank you.
Yes, I mean, of course, I think to answer such a question, we have to look at the level of development, the status of economies, and the development of the research capability, both particularly in the private sector, because we know that these vaccines, of course, are being developed by a collaboration between scientists in the public sector and in the private sector in well-developed multinational pharmaceutical companies in most of the countries, or very much by major state entities in working also with scientists in the private sector in countries like China. So I mean, I think to be quite fair and frank, if we look at the capabilities of the economies, the scientific sectors, the African region is being acknowledged for many reasons, and we can go into the reasons, including the history of Africa, including the history of how Africa related with the more developed continents and countries over history. I don't want to go into stories like colonialism and slavery and what has happened in terms of global history and development, but simply to acknowledge that indeed there is need for African countries to invest more, and this has been acknowledged in Africa, and also to spend more on research. There are countries that do this. I think there are countries that have been able not necessarily to develop a vaccine from scratch, but certainly to participate in the discovery of vaccines. I think what we also have to acknowledge is that some of this is progressively and increasingly work that is being done collaboratively across countries, across both upper income, wealthy countries and lower income countries. And what we can encourage is the engagement of African scientists, encouraged and supported by their governments in this collaborative research, so that some of the research is carried out in Africa. There is some production capacity in some African countries, in certainly some countries like South Africa. It needs to be increased in some of the North African countries, which are already producing, manufacturing some vaccines that have been developed elsewhere. We have the example, of course, of the yellow fever vaccine that has been developed and produced in Senegal for many years, and is the main supply of yellow fever vaccine in the world. So what I can say is that there is a realization of the need for more collaboration, certainly more investment in Africa, but I think we also need to take into account the state of development of the economies of African countries. Certainly, Africa has scientists that are as good as scientists anywhere else. I think what is needed is the partnerships, the working together, and the investment and resources, both then in participation in the discovery of vaccines, and also it's been very dramatically demonstrated in the manufacturing and production capacities of vaccines that may have been developed elsewhere.
Sorry, I think we're still having issues with our moderator, but I believe that Emile has a question and would like to ask it live. Over to Emile.
Yes, I'm here.
Yes, please ask your question. I think you have a question.
Thank you for giving me this opportunity. I address my questions to Dr. Moeti. The first one is a few weeks ago, the Minister of Public Health in Burundi said to wait until the end of the experimentation phase to order the vaccine, the COVID-19 vaccine. So the government of Burundi considers that the WHO and its partners are still testing vaccines. What do you think? And my second question is, you know, Tanzania has about 60 million people, and Burundi has about 11 million people. What consequences can we expect in Tanzania and Burundi and in all the East African community region if these two countries continue to hesitate on the use of vaccines as well as on barrier gestures, can we expect, for instance, collective immunity or chaos? Thank you.
Yes, I think the comment that vaccines are still being tested, first I'd like to precise it's not WHO that's testing vaccines. It is the scientific community working together, as I've just said in my response to the previous question, working together in partnership to develop and of course test vaccines. Testing vaccines is a very important step on the way to developing effective and safe vaccines. It is absolutely necessary. We cannot have vaccines being developed in a lab and then being deployed on populations. These tests are being done under the strictest scientific standards that have been accepted internationally to make sure that in the process of testing, people's lives are not endangered and we come out with the best performing products that can be then safely used to protect people, the population. This has been done at an unprecedentedly rapid rate based on research and development that had been going on in the past, looking at these types of viruses. So I would say it is a very important part, testing of developing vaccines. It has been done properly and well, and there are processes ongoing to then look at the data and apply what we call in WHO an emergency use listing of the use of these vaccines. All these steps have been undertaken to the best international standards. After that, once the vaccines have been given this regulatory approval for emergency use by WHO and by the regulatory authorities of countries, then they are safe to use. And what I then will say to the next part of your question is that we're encouraging these countries, Burundi, Tanzania, other countries that have yet to come on board, to do so and are committing to support them. Some have questions remaining about some of the requirements for them to be able to have access to the vaccines. And it's been said by many people before in our urging the international community to collaborate on ensuring that there is equitable access to vaccines. As long as there are pockets of populations that are not vaccinated, that puts at risk everyone. So it applies within the neighborhood in East Africa that you cited, that as long as there are countries that are remaining behind with their population not vaccinated as others are moving ahead, that's going to continue to constitute a risk. Particularly, I'd like to add, because the reality is that in African countries, although we would wish to have that ambition, it will not be possible to very rapidly acquire the vaccine supplies and within some months or even within this year, be able to reach the level of coverage of populations that will give population immunity. So this only then remains for us to continue to encourage and to urge these countries to know that their neighbors have used the information that's available internationally of how these vaccines were developed. And to add that there are many, many vaccine candidates in many countries that are being developed. There is a very meticulous process of ensuring that the highest standards are being applied before these vaccines are being licensed or listed for emergency use in countries. So I'd urge the countries to trust WHO, to trust the scientists and the international community, and to act as first good leaders and the responsibility for their own populations and also responsibility for the neighborhood. I think we have something called the International Health Regulations, which urges all countries to work hard to prevent the international spread of disease. And then this is something that we would encourage them to also take into account as they are signatories of the International Health Regulations.
Thank you very much, Dr. Moeti. Again, apologies, everyone. We continue to have issues with our internet. But I think we will now start wrapping up this press conference. I'd like to go to our speakers for their final remarks. Mrs. Perpetual, over to you.
Thank you very much. I want to first of all express my appreciation to the WHO for this opportunity to be a panelist in this virtual press conference. Indeed, the issue of COVID-19 and its impact on population is one that is going down in history as what we will all talk about in the years to come. But for the fact that we don't know what the future holds, it's important that we all continue to work together, to collaborate, to partner, and to see to it that what needs to be done is done in terms of vaccine development, vaccine deployment, and all that, so that we can get to everyone to be vaccinated, to be protected. Going into the future, the fragile health systems that we have need to be developed, and the allocation of health budgets should be enhanced. Per the Abuja Declaration 20 years ago, governments committed to apply 15% of the national budget to health. And most of these countries are doing way below the 15%. But we can do better, 15% or more, so that we can adequately develop the health sector in terms of infectious disease and also building the capacity in terms of medicine and infrastructure for other communicable and non-communicable diseases. So we hope and pray that even as vaccination goes on, health workers everywhere will be prioritized so that we can be adequately protected to give the care that we are trained to give. Thank you very much.
Thank you very much, Mrs. Perpetual. We echo and hope that also healthcare workers will get vaccinated soon. Over to Mr. Ferdinand.
Thank you very much. I just wish to really say that, non-communicable diseases are responsible for more than 70% of the disease burden. But yet they are not just underfunded, but they are also almost always, and I say this, almost always neglected in considerations when it comes to making things work for those conditions. As an advocate for NCD prevention and control, it's important for me to state that during this COVID-19 pandemic, the people living with NCDs have cried for protection. The services for these people living with non-communicable disease have been disrupted. And there is need in recovery to make sure that we don't just listen, but that we act as far as NCD prevention and control is concerned. And that action means that we need to prioritize people living with chronic NCDs as far as vaccines are concerned, so that they can be protected. And this is one of the things that we know we have listened and heard. They need to be protected from this, from the severity that is as a result of COVID-19. So I think those are some of the key messages. We need to keep supporting these people and other priority groups. Thank you for the opportunity to be on this panel, and I just thank you for the opportunity to be here. Thank you.
Thank you. Now over to Dr. Moeti.
Yes, thank you. So first, I'd really like to thank my fellow panelists for having joined us, Mrs. Ofori-Ampofo and Mr. Sonyu, and for having exchanged your rich experience and your point of view on these very important two themes with us and with our colleagues, the journalists. And to conclude and to make the link again, I really think nothing can say it better than universal health coverage, which increasingly sounds like a slogan, but which is the framework within which we can work on all of this. We can deal with, of course, the very precious resource, human resources for health, which is health workers, which is at the core of our ability to achieve universal health coverage and manage our healthcare workers, invest in them, invest in our systems so that they are present everywhere, able to provide services to detect outbreaks, including those that might lead to a pandemic, and to work to provide the public health interventions that are needed to contain outbreaks and to protect them, as is being done now by putting them at the top of the queue as far as access to vaccines is concerned. And then again, to make the link between chronic non-communicable diseases and other health conditions. And I think we, in order to be efficient, and it was said by our colleague, Mrs. Ofori-Ampofo, that financing for health is a challenge in the African region. So we must find ways to make links between what is invested in infectious diseases and the benefit for non-communicable diseases and the types of similar interventions as we develop our healthcare systems. And as we inform people, educate people, help them to be health literate and to take care of themselves, as we make legislation and regulations that reduce some of the risk factors that drive some of these diseases, both in terms of communicable and non-communicable diseases. So I think the pandemic is teaching us that this is all interconnected, and our strategies, our actions, including at the household level, need to take that into account. And finally, just to say that we rejoice that we are able to start this vaccination, and we see that the opportunity is there to expand this work. But in the meantime, we must continue with the public health protective interventions at the household level by individuals and also in the public health system. So while we are working on the vaccines, we must still work on the testing, contact tracing, isolation, until we reach such a stage that the risk of the virus being transmitted is very much reduced. So thank you all for having joined us this week.